Next medication on our list is going to be the nasal spray, and that's just a generic name that we can use. One of the most common trade names is Afrin, and the mechanism of action here is a vasoconstrictor. So again, nasal spray is advertised as nasal decongestants. They can be given for runny noses or allergies. However, for pre-hospital purposes, the only indication is epistaxis, which is a nosebleed. Okay, so that means that the mechanism of action is a vasoconstrictor, which is going to help constrict those vessels and stop the nosebleed. So contraindications, reason why we would not give it would be significant hypertension. So again, I've added another note on here that the nasal spray is given for epistaxis, but it should not be given in cases of severe hypertension. So it's really important to rule out that the hypertension was not the cause of the nosebleed before you administer. Other side effects, it can cause hypertension on its own and cause burning in the nostrils. You would give 2 sprays per affected nostril for the adult patient and 1 spray per nostril for the pediatric patient, and it is given intranasally. Next medication is nitroglycerin. Some of the trade names for that are nitrostat and nitrolingual. The mechanism of action here is that it is a vasodilator, and it is indicated for patients with chest pain. Okay, so I've added a couple of notes here. Both forms that you see on the screen, the tablet and the spray of nitroglycerin, are administered sublingually, which means that they're given underneath the tongue. So whenever you're preparing to do that, you should advise the patient not to chew or swallow the tablet, but to allow it to dissolve under the tongue. If you're going to give the spray, then you want to prime the pump of the spray by giving 1 spray into the trash can prior to spraying, putting 1 spray underneath the patient's tongue. Now, either way it comes, in the tablet or in the spray, you need to be really cautious to yourself that you are using the proper PPE, that you have gloves on, that you are not accidentally spraying this or it coming into contact with yourself or your partner or the patient's skin, because it can be absorbed that way and it can actually cause adverse effects to you. So you'll see a test question that asks about which medication could be potentially dangerous to the provider, and this is it. Okay, so contraindications, reasons why we would not give this medication, and these are very important. I cannot stress this enough that you need to know these by heart. Head injury, the systolic blood pressure less than 100. All right, the blood pressure, the systolic, the top number has to be over 100 for you to be able to administer this medication. If it's not, they are not a candidate to receive it, because this is going to cause their blood pressure to drop even more. All right. Also, the use of erectile dysfunction medications in the last 24 to 48 hours, and that depends on which medication it is as to how long it stays in their system. That's because that is also a vasodilator. So if you add the 2 of those together, it could be potentially fatal. So please make sure that you are asking questions about that to your patient. Side effects, burning underneath the tongue, headache, and again, the most serious of those is hypotension. For the adult patient, the dose is 0.4 milligrams, which is 1 tablet or 1 spray. That can be given up to 3 times, all right, without calling medical control for additional doses there. Now, you will see in red that if the patient does not have a prescription for the medication, then you need to call medical control anyway for permission to administer. But most of the time, if they do have a prescription, you can administer up to 3 doses of the medication every 5 minutes. Now, in between each dose, you need to reassess the patient, reassess their blood pressure, reassess their pain. Are they still a candidate for the next dose? All right, and you'll see that this is not recommended for pediatric patients, so it's adult patients with chest pain who have been previously prescribed the medication or who you have called medical control to ask for permission to administer. Next is oral glucose. One of the trade names for this is glucose, and the mechanism of action is that it provides glucose for cell use. So you're essentially giving the person sugar to raise their blood sugar. Indications for this is hypoglycemia or low blood sugar. Contraindications would be if the patient is unconscious, unable to swallow, or unable to follow commands, or if they are vomiting, all right, because we don't want to put anything in their mouth that could potentially cause them to choke or aspirate. Side effects of this are nausea. For the adult patient, the dose is 15 grams, which is usually what you find in 1 tube. And for pediatric patients, as much as you need to, up to that 15 grams. Typically, for most patients, you will start seeing start seeing signs and symptoms related to hypoglycemia and providing treatment when the blood sugar is around 60 or below, but that could vary from person to person. And then the route that this is administered is buccal. All right, so make sure you understand that. If you need to go back and look in that first video as to how this is administered between the cheek and the gum and how it is actually absorbed into the mucous membranes. So this is not for the patient to swallow like cake icing. All right, it does need to be absorbed correctly through the mucous membranes in that buccal area for it to work effectively. Next on our list is oxygen, and so we're going to talk a lot more about this in the airway section, but just so that you know that oxygen is a medication, that you will be administering it, and understand how much per device. So it's oxygen. It provides oxygen for cell use. It's indicated for patients who are hypoxic or having dyspnea, which is difficulty breathing. Contraindications, very specific contraindications here are paraquat poisoning, which is a very specific type of pesticide where oxygen could worsen their symptoms. And we want to be cautious with the use of oxygen for COPD patients. So if they're having trouble breathing, we don't want to withhold oxygen, but we also don't want to give them too much as it could potentially knock out their hypoxic drive, which would be one of the rare side effects here. So looking at the doses for both adult and pediatric patients for nasal cannulas, that would be 1 to 6 liters, which delivers 24 to 44% oxygen. The non-rebreather, which at 10 to 15 liters of oxygen delivers up to 90%, and the BVM at 15 liters delivers 100% of oxygen. And then we also have the nebulizer, which we would use with our albuterol or levobuterol, and we would use that at 6 to 8 liters of oxygen, and that would be for inhalation. And then last here is the topical hemostatic agent, and one of the trade names for that is QuikClot. This is there to stop life-threatening hemorrhages, so it's indicated for severe life-threatening bleeding. It usually started on the battlefield, so thinking about military use, but it is starting to make its way into the civilian world. There's no contraindication in the emergency setting, and you could see it as a powder or embedded into actual gauze to help stop the bleeding. Now, it can cause some burning or irritation at the site of application, and the dose would be 1 package or 1 gauze, and this is applied topically. So that's it for our medications. I will be posting a separate video related specifically to drug cards.